Hello students, welcome to EPG Pathshala. I am Dr. Renu Tyagi from Sardar Patel Institute, Ahmedabad. Today we will discuss the module titled Impact of Smoking on Cardiorespiratory Functions under the paper Physiology and Sports Anthropology. Now let's see what are the learning objectives of this module. After finishing this module, we will be able to understand the physiological changes taking place in one individual due to the smoking habit. We will be describing the harmful constituents of the smoke. We will come to know about the addictive behavior of the smoking, how one becomes addicted to the smoking. We'll try and understand the impact of the smoking on the cardiovascular and respiratory system of the human being. And in the last, we'll try and recommend some preventive measures to avoid the smoke. Now, as we have all commonly heard that smoking is injurious to health, it is more than a statutory warning. Smoking, that is the use of tobacco, is our greatest health threat to the individual all over the world. It's growing like an epidemic and growing nearly at a rate which is much faster or higher than the rate of the population growth. The rate of smoker is on the decline in most of the developed or industrialized countries, but it is increasing at an alarming rate in most of the developing countries. For instance, India is one of those. A higher percentage of youngsters are indulging themselves in smoking, and this could be because of the matter of curiosity, or that curiosity could be generated by the peer group or due to the social pressure. The kids just want to feel the grown-ups and they just take up the habit. But tobacco is highly and strongly addictive. Means once a person start taking the tobacco, they get used to it. They just can't avoid it. They just can't live without it. That is because of the scientific rationale behind it, because of a presence of a substance called the nicotine in the smoking. More than half of the men in the third world countries use tobacco in one or the other form, such as in the form of cigarette or a cigar or pipe, whatever. Cigar is a liquid component. The smoke pH value is 8.5, at which the nicotine is relatively unionized, that is liquid soluble, and thus it is readily absorbed from the mouth and it directly goes to our digestive tract. And thereby it may cause mostly digestive problems like the duodenum ulcer, whereas cigarette smoke is of the pH value 5.3, where the nicotine is in the ionized form and so less absorbed from the mouth, but it directly goes to our lungs and affects the lung functions. Another way of taking the smoke is the hookah, the traditional smoking system, or in the pipe smoking. The carbon dioxide formulation is much less and thus better than the cigar or the bidi, than the cigarette smoking. The cigarette smoking is mostly causing cardiorespiratory problem. That is why cigar or the pipe smoker have the lower mortality than the cigarette smoker, as they inhale the lesser amount of smoke. let's study the impact of smoking. The impact of smoking depends upon the methods of inhaling the tobacco, such as in the form of cigarette or cigar or pipes, etc. It depends on the type and method of preparation of tobacco. It also depends on the quality and the frequency of smoke inhaled. Eco-sensitivity and current physiological status of the person. The eco-sensitivity is examinable variable or factors that affect the individual more. Hybrid rigor can be examinable on the basis of eco-sensitivity. It is like what conditions are influencing that determines the better development of the variable. For instance, height, because of eco-sensitivity of growth, are better in a particular condition. Synergistic effects, that means the combination of various factors when act together to cause the effect, it is known as the synergistic effect. Now let's have a look on the relationship between smoking and the mortality. It has been found that the cigarette smokers have approximately 30 to 80% greater mortality than the non-smokers, and the mortality increase with an increase in the cigarette consumptions. The mortality is lower in smokers who have stopped smoking than those who continue to smoke. Also, the mortality approaches the level found in non-smoker as the duration of abstinence smoking increases. Those who inhale the smoke, that is the passive smokers, have higher mortality rate than those who do not. Also, it is higher in those who start smoking at an earlier age than those who have started later in life. The mortality because of cigarette smoking is proportionately greater at the age of 45 to 54 years than at a younger or older ages. The smokers of pipe or cigars have slightly excess mortality than the non-smokers of the about proportion 20 to 40%. They are gradually moderate smokers who do not inhale, and thus there are lesser chances of mortality among them than those who consume the cigarette. The harmful elements need to be studied in the cigarette smoke in a much detailed form. The major components of the tobacco smoke are nicotine, carbon monoxide, and some carcinogenic substance. Nicotine present in the smoke disturbs the acid-base balance, and it increases the chances of getting peptic ulcer, causing indigestion, loss of appetite, and power to assimilate food, which leads to the reduction in food intake, energy liberation, and hence it influences our work capacity. It could be as powerful as cocaine or the heroin. Carbon monoxide present in the smoke form due to the incomplete combustion can cause lesser oxidation of metabolites and may responsible for the lower supply of oxygen to the muscles. This ultimate results in the lower oxidation of glucose, a decrease in the food intake, and lesser of glucose limit every liberation and therefore reduce activity level and hence the physical fitness. Malnourished and undernourished conditions develop, which results in the low endomorphy and high ectomorphic physique. Some of the carcinogenic substances found in the tobacco smoke are tar, arsenic, cadmium, nickel, vinyl chloride, creosote, and polonium 210. All such substances may cause the irritation of our respiratory tract, may result in cancer, is responsible for the dizziness, headache, tiredness, etc. Some of the other toxins or the irritant toxins in the smoking like ammonia, acetone, acrolein, hydrogen cyanides and toluene present in the smoke may cause loss of appetite, memory loss, weakness, tiredness, and it may also irritate our lungs. The atmospheric dust present in the smoke also irritates the respiratory tract and allergic symptoms. Generally, dust particles will not go beyond our nose as they struck by the hair follicle of the nose, but particles which are so small to struck goes into the lungs and affect it or irritate the lungs. Let's have a look at the effect of smoking now. The quality of the life is mostly compromised because of the smoking habits, because that influence our lung functions. The smoking influence the lung functions and they are diminished to a great extent among the smokers than the non-smokers. Smoking is known to cause hypertension. It's a great factor which is responsible for the hypertension among the young adults nowadays. Smoking increases the chances of getting a heart disease, especially the ischemic heart diseases. The nicotine present in the smoke disturbs the acid-base balance of our body and it increases the chance of getting the peptic ulcer, causing the indigestions, loss of appetite and the power to assimilate the food, leading to the reduction in the food intake and simultaneous energy liberations, and thereby it affects our physical work capacity. The dangerous component, that is carbon monoxide, present in the smoke forms the carbon monoxide hemoglobin complex that may cause the lesser oxidation of the metabolites and lower supply of oxygen to the muscles, which brings the change in the lower oxidation of the glucose in our body, that makes our body feel more lethargic. The decrease in the food intake and the lesser oxidation of the glucose limits every liberation and thus reduces the activity level and hence the physical fitness of an individual. It brings about the changes like the undernourishment and malnourishment. Such conditions developed which will eventually lead to several problems relating to our physique, influencing our respiratory system and thereby affecting the related cardiovascular functions like blood pressure, heart rate, pulse rate, our lung volumes, lung capacities. All systems which are interrelated are significantly influenced by the smoke. Let's have a look of impact of the smoking on our circulatory functions. The tobacco smoke contains up to 4% of volume of carbon monoxide. By inhalation of the smoke, some of this carbon monoxide is absorbed. The affinity of the hemoglobin to carbon monoxide is about 200 to 300 times greater than to the oxygen. The presence of even small amount of carbon monoxide may therefore reduce the oxygen transporting capacity of the blood. The carbon monoxide may also interfere in a negative way with the uploading of the oxygen in the tissues by shifting the oxyhemoglobin dissociation curve towards the left. Studies have shown that subjects who smoked 10 to 12 cigarettes a day has 4.9% carbon monoxide hemoglobin complex, and those who smoke 15 to 25 cigarettes a day have 6.3%, and those who smoked 30 to 40 cigarettes per day have 9.3% carbon monoxide hemoglobin complex in their blood. This amount of carbon monoxide in the blood gives no subjective symptoms at rest as long as the concentration of carbon monoxide in blood is below 10%. The adverse effect is noticeable only during the physical exercise. Some of the studies have confirmed that it may take 1 day or more for the carbon monoxide content of the blood to return to the normal if it's below 10%. In another study, the normal subjects who worked on a bicycle ergometer without having smoked 12 hours prior to the experiment and immediately after smoking 1 or 2 cigarettes was performed. It was noticed that oxygen uptake, pulmonary ventilation, and respiratory rates were unaffected. However, a slight rise in arterial blood pressure was noted, but the difference was not significant. At a fixed oxygen uptake, the heart rate was 10 to 20 beats per minute higher when the work test was preceded by the smoking. The difference in heart rate between smoker and the non-smoker was increasing as the workload increases. The effect of smoking could not be observed if the subject waited 10 to 45 minutes after smoking before the work test started. But it is very well established that the endurance diminishes with the smoking. Now let's have a look on the impact of smoking on our respiratory functions. It was pointed out that inhalation of smoke from a cigarette could cause within a second a 2 to 3 fold increase in the airways resistance. The nicotine present in the smoke constrict the terminal bronchioles, therefore increasing the airway resistance. In addition to this acute effect, the smoking may also cause chronic swelling of the mucous membranes of the airways, generating more resistance. Smoke immobilizes the cilia present in the airways, thus, they do not drain the mucus efficiently. At rest, when the pulmonary ventilation is less than 10 liters per minute, the increased airway resistance is not noticeable. However, when the demand on respiration is elevated, the increased respiratory resistance caused by smoking may cause change in respiratory functions. Reduced pulmonary ventilation occurs and it causes a smaller volume of oxygen to reach the alveoli, resulting in an impaired gaseous exchange. Also, the efficiency of the gas exchange is reduced as the smoke causes destruction of elastic fibers in the alveolar wall, reducing their elastic recoil. Smoke also injures the macrophages in the lungs so that they cannot fight with the infections occurring in the air passage. FEV also declines. The respiratory endurance or capacity of our lung functions greatly reduced among the smoker as compared to the non-smokers. Smoking and its addictive nature need to be studied. So let's have a look on those addictive natures. As it has been seen that smoking increases a person's addictivity towards the smoking. This is due to the presence of the nicotine in the smoke. The smokers perceives the immediate effect of smoking as something positive, a stimulant that makes them feel alert, composed, rational, clear-headed, and allowing them to focus on the work. However, this perception is an illusion. Within a few seconds of first inhalation, nicotine, an alkaloid, is absorbed in the bloodstream and transits the barrier that protects the brain from most impurities and begins to fit on like keys or nicotine receptors on the surface of the brain's neuron cells. In fact, nicotine fits the same keyhole as acetylcholine, which is one of the brain's most important signal chemical or the neurotransmitter. This elicits the body's excitation chemicals like adrenaline and non-adrenaline. This stimulates an increase in the flow of blood to the brain. The smoker feels momentarily alert and good, partly because he has just ended a period of nicotine deprivation. Within half an hour or so, the amount of ingested nicotine is reduced and the energy of the smoker declines, and the urge to smoke increases again because of nicotine deprivation in the brain. The urge of the smoke becomes a physiological phenomena in addition to the psychological. Therefore, smoking becomes addictive in nature. Let's have a look on the different kind of diseases and disorders which may result due to the smoking. The first one to be studied is the emphysema. It is a disorder characterized by the damaged alveolar walls caused by the irritants such as cigarette smoke, pollutants, and industrial dust. The alveoli lose their elastic fiber, so the exhalation is not complete and the stale air remains in the alveoli, thereby reducing the efficiency of gas exchange in our lungs. In the situation like emphysema, there is an increase in total lung capacity, but the vital capacity remains normal. Also, there is a marked reduction in the FEV1. Thus, it is also referred to as an obstructive ventilator defect that is non-reversible. In patients with emphysema, the problem of transfer of gases aggravates. Diffusion of gases is a quick process so that 80% of it is completed in about 0.002 seconds because the size of the alveoli is quite small. It's of about 100 microns approximately, and the distance of diffusion is nearly 0.5 mm. But in the patients with the emphysema, these alveolar sac may be destroyed to form one air sac. Also, air sac may be enlarged under exceptional cases without the destruction of wall. The distance of diffusion may increase to the 7 mm and time required for diffusion can be 38 seconds. This causes the hypercapnia. Mortality rate due to emphysema, a lung disease, is much higher among the smokers than the non-smokers. The next medical health problem due to the smoking is the bronchitis. Now let's see what the bronchitis is. The bronchitis is an obstructive ventilatory disorder that does not respond to the bronchodilate therapy, in which bronchioles constrict, causing the severe airway resistance. Another symptom of the disorders due to the smoking is the cough or phlegm. Phlegm is a form of bronchitis, but it's mucus based. Cough is to expel the air forcefully and noisily from the lungs through the glottis, either as a result of an involuntary muscular spasm in the throat or to clear the air passages. The frequency of cough, phlegm, and bronchitis is reported to be quite higher among the smokers than among the non-smokers. Now, the next category of the diseases due to the smoking is chronic obstructive pulmonary disease, that is popularly known as the COPDs. Any factor causing the chronic and recurrent obstruction to the airflow increasing airway resistance result in the COPD. These factors include the cigarette smoking, or it could be due to the air pollution or pulmonary infection, and maybe due to the family background or the genetic factors. Let's have a look on the recommendations to prevent the smoking. As we have studied by now that smoking is not good for health and it may result in several health issues. And we have understood that it is very addictive in nature. Therefore, it is recommended that those who smoked about 35 cigarettes a day should reduce their cigarette number day by day and not abruptly, as it may cause greater damage. The next recommendation is that the smokers should reduce their number of cigarettes slowly day by day, as it may diminishes the nicotine deprivation gradually, but suddenly stoppage of the cigarette cause much elevated nicotine deprivation in the brain and thus cause the bigger damage. It is also recommended to the people who smoke to exercise daily, which will help to recover respiratory and circulatory endurance, or indulging themselves in the physical activities like outdoor sports. To avoid the urge of smoke, it is sometimes advisable to have any kind of mint or mouth freshener. It is possible that the smokers can reduce their effects of smoking and can reach a level those found in the non-smokers. So students, let's summarize what we have understood by this module on smoking. We have studied the components of the smoke. We have understood how the smoking becomes addictive in nature. We have studied the different changes which are brought about due to the smoking among the people's cardiovascular or respiratory functions. The anthropological and psychological experiments all suggest that the non-smokers are always better than their active smoker counterparts, and the deprived smokers for all kind of work from the simple to the complex. For instance, for a simple work, the difference between the active and the deprived smoker is minimal. However, with the increase in the complexity of the work, the difference between the two categories of the smoker increased, and the deprived smokers generally performed much better than the active smokers. The smoke generally immobilizes the cilia present in the airways, so they do not drain the mucus efficiently, thereby affecting our respiratory system. The nicotine present in the smoke constrict the bronchioles to a significant level, especially the terminal bronchioles, thereby increasing the airway resistance. So, lesser air goes into the terminal bronchioles and thereby slowing down the diffusion of gases between our respiratory system and the environment. The poisonous gas, that is carbon monoxide, present in the cigarette smoke binds with the hemoglobin of our blood, reducing the oxygen carrying capacity of our blood. The smoke caused the destruction of the elastic fibers in the alveolar walls, reducing their elasticity, thereby bringing about the change in the efficiency of the gaseous exchange between the lungs and the outer environment. The smoke is quite injurious because it inflames our lungs to a greater degree, and it makes our lung less resistant to fight against the infection, thereby increasing the vulnerability of our respiratory problems. The smoke irritates the lining of our bronchial tree, causing the swelling and increased mucus in the bronchioles. And this will eventually lead to the drastic increase in the airways resistance and hence lower gaseous exchange. So in all, we can say that smoking always influence our cardiovascular system or especially the respiratory system in a negative way to a significant level. So we need to think about before the smoke seriously. Thank you.